It's normal to have some mucus production for the nose and sinuses, but when you have allergies or a sinus infection like I have now, you can have an excess of mucus production. I'm Dr. Sinan, GP and longevity doctor. Right now, I have a heavy pain right here on my left cheek, which is a sinus infection that I've had for a week or so, and it's causing a stuffy nose and a post-nasal drip. I get this about every year or so, and one of the best ways that I manage this without the need for any medication, such as nasal steroid sprays or antibiotics, is with nasal irrigation, especially if I treat it nice and early. Sometimes you do need medications, especially if you have a fever or you're feeling unwell and it's just not going away. Either way, nasal irrigation will help decrease inflammation and help you breathe easier, as well as helping you function better. There are quite a few products out there, but I use this one. It's called a NeilMed Rinse. I'm not selling this, I'm not an affiliate, and I'm not getting paid for this video. This is just me as a doctor sharing my experience with you for someone that generally every now and again suffers with this nasal congestion. I use this product for a couple of reasons. One is that it works for me and my patients. Those of my patients that have chronic sinusitis, they have found that this product tends to be the best at keeping their symptoms at bay and preventing aggravations and preventing flare-ups. The second reason is that it lasts a long time. You get quite good bang for your buck in terms of the cost, and when you're actually using the product itself, you can control the pressure by which you squirt liquid into your nose. Other products that have a similar function, like neti pots, don't have the same level of control, so you're kind of just pouring fluid without a control of pressure and without the ability to stop. So I quite like the ability to have a little bit of control about when to squeeze and when to push the fluid through my nose. The other element is that there is a proprietary blend that you apply to the water, which is hypertonic, it's pH neutral, tends to be quite effective at clearing out all the pollutants and the dust and the allergens in the nasal passages, as well as not being too irritating because it's pH neutral. If you're interested, it costs about 15 to 20 pounds in the UK, and as I mentioned, I do not get any money for this. I'm not getting paid for this. Here's how I use it. Wash your hands and fill with the right amount of water. As you can see on here, there is a little line at the top, which is about 240 mils of water. The company itself advises that you either use bottled water or you use cool boiled water. There's big red signs on it saying don't use tap water. I don't know why. What the hell, just use cooled boiled water. If you don't like cold water, you can warm the water slightly in a microwave so it's a little less jarring. The second step is to add a sinus rinse to the mixture. So each of these boxes comes with about 60 of these little sachets. Within these sachets, you fill this with water up to the line, pop the sachet in, give it a shake, and then you're pretty much good to go. When you're ready to go, stand in front of a sink, bend forward slightly and tilt your head down. Keeping your mouth open without holding your breath, place the cap snugly against your nasal passage and then squeeze. Once you squeeze, you'll notice that the liquid starts to come in through this side and then out through the other nostril. Some of the liquid may drain into the mouth. Keep squeezing on one side until you get through about a quarter of the bottle, which is about 60 mils. After that, take a little break, blow your nose gently. If you've got a little bit of residue there, you can gently sniff in just to try and clear the airway. If you've got something in your mouth, feel free to sniff it out. The advantage of sniffing in is that it helps to get to the posterior nasopharyngeal area, which you can't always easily access just by squirting. So it's no bad thing just to give a gentle sniff. Sometimes if you're finding it in your mouth, do spit it out. Once you've done that on one side, same again, repeat on the other side, head forward, squeeze, liquid should come out on the other side, and continue. You only need to use this treatment if you have symptoms, or if you're one of those unlucky people that tends to get symptoms in the absence of using regular irrigation. Once you're done, don't forget to clean the cap, give it a clean inside and let it air dry. Many thanks for watching. If you try this, I do hope it helps. Hit that subscribe button. Till next time, stay healthy.